Hello, everyone. Welcome to Daily Lecture 3.1, Identify Dermatological Pathologies by Images and Presentation. All right, so this is a big chapter with a lot of important stuff. So I have divided it into 3 separate days for you. So today we're just going to talk about general skin lesions, bacterial skin infections, and fungal skin infections, so we can give some of these the proper attention that they deserve, and to make it a little bit more bite-sized and manageable for this large, potentially dangerous topic. All right. Skin lesions. These are dermatologic pathologies in general that are described by the presence of skin lesions. Lesion is a variation from normal tissue. All right. It can be caused by just about anything: radiation, medication, exposure to things, scratching it too hard, you name it. A lesion is just an absence from or stepping away from the normal appearance or function of the skin as a whole. Now, while you are working on a client that might have a dermatologic disease or pathology, what you're going to want to do is pay attention to how things feel and how things look. You're going to look for areas of redness, places where you see strange lumps in the body, excessive bruising, hives and rashes on the body. If you see any masses, if you observe your client scratching a lot, signs of swelling, which is edema, or possible dehydration, maybe some dry, flaky, white or gray skin, suspicious looking moles, or any wounds, especially wounds that look almost unhealed or unchanged from one session to the next. Some things you're going to want to palpate is if their skin feels cold or really, really warm. If you can feel an enlarged lymph node or nodule under the skin, if there's a spot in the skin that suddenly feels very mushy, if the client complains about pain, if you start running your fingers over the skin and it goes from being very smooth to very bumpy all of a sudden, or from normal texture to suddenly very slick and it's not scar tissue, that's a sign. A light raised area, especially if it's an irregular raised area, these are all types of things that you're going to want to palpate or feel for. Now, before we move on, topical prescriptive products and massage. I would argue not just prescription products like lotions, creams, foams, and gels for skin conditions, but over the counter medicative devices, creams, anything of that nature, like Neosporin or an antibiotic petroleum based cream of any type. These are a no-no for you. They are out of your scope as a massage therapist, and you definitely do not want to be touching them. Use your regular massage creams and lotions. If they need theirs applied before they leave, you can always use a warm, moist towel, like a hot towel, to wipe off the areas if they're not a local contraindication. That's another problem. If it's a contraindicated spot, you shouldn't have touched it anyway to begin with. But if it is an area that you can work on, you can remove some of what you have applied if there's any remnants, leaving space for them to go ahead and put on their ointment before they leave your office. You don't do it, they have to do it. Um, before they leave without that barrier of your cream or oil in the way. That's the best you can do for them, is just to remove your product before they apply their own product before they go. But if they give you something to apply on their skin and you think that there is a single claim that it is medication in any way, shape, or form, don't touch it. Don't do it. All right. I'm not going to spend a lot of time on this, but please be aware this is a flashback to week 1. Please pay attention to disinfecting contaminated surfaces, hard surfaces, soft surfaces, reusable objects for sure, because you're using these in between every single client, and linens and fabrics. There is so much that can grow and multiply and flourish and ugh, wash your laundry, sterilize it, steam it, dry it, beyond, an inch of death that needs to be cooked in order to get some of what we are going to talk about baked out of your linens. All right. But remember, when you are disinfecting and cleaning, please never mix household bleach with ammonia or any other cleanser. We're talking about forming different kinds of acids and gases in the air. You could burn your lungs out. So please make sure you are reading the information and using your cleaners correctly, but also make sure you are cleaning up after these clients. All right. Primary skin lesions. Skin lesions are categorized as either primary or secondary skin lesion. Primary skin lesions are changes in skin color or texture by the disease. All right. And these are some images of those. And we will talk about some of the primary skin lesions as we go on. All right. But you can always download the PDF to check out the names of these and what they look like in detail. Now, do know that for your MBLEX, there will be no visuals like this. You're just going to get multiple choice questions, probably on the proper terms and names for things, as well as maybe some information describing it, its symptoms, or if it's a local or total contraindication. Those are the types of things that you're going to need to know on the MBLEX. But for your industry savvy and for your own safety, you're going to want to know what these look and feel like. So I have provided imagery for you. Secondary skin lesions develop from the primary lesions. The primary lesion has happened. Now a second one is building, usually from external forces, like you have been scratching it way too much, or something else is forming due to the healing process. Again, if you download the PDF, there's some pretty interesting imagery here for you on those. All right. Our first major topic of two, we're going to talk about bacterial as well as fungal skin infections. Let's talk about bacterial skin infections. Acne is our first one. It is a bacterial infection in which skin containing hair follicles and sebaceous glands overproduces an oily substance, probably usually sebum, which sticks together and forms a keratin plug. This later develops into a lesion called no, your book has it wrong. It is a comedo or comedo. All right. There is no NE on the end of a singular comedo, which is a singular pimple. Those of us here in the Midwest have probably heard the term comedone. That is incorrect. So is comedones. It is comedones, imagine a fantastic Latin dish. All right. Comedones. It's whiteheads, blackheads, or pimples. Comedo is singular. Comedones is plural for these. It's also called acne vulgaris. All right. You can remember it's pretty vulgar looking sometimes. Acne vulgaris or acne folliculitis. All right. Does that sound like follicle, like hair follicle? You would be correct because it's an infection of skin containing hair follicles. All right. Bacteria and hormones are the main culprits for these. These pimples can progress to papules and pustules, the nodules and cysts. All right. Affected skin often appears and feels oily and greasy. There might be scarring. You might have pitted or smooth skin due to the scarring from cysts and larger nodules being popped. All right. For massaging these areas, you should avoid them because the pressure and friction from massage and massage lubricants may cause it to worsen. Hello, you are spreading this person's other bacteria from other parts of their body into those open areas of the acne. All right. This ruptured pustule is contraindicated as a massage lubricant. You're not going to rub your little bit of lotion in here, pick up some of their pus, and suddenly have more lubricant to spread around. No, 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 absolutely not. Table warmers and hot packs. Not only could you get their infected pus on those objects, it can actually bring those comedos or those comedones to a head and cause them to bubble up, perhaps even rupture while they are on the table with the heat. All right, so please be aware this is a local contraindication. Stay away, stay away. Folliculitis, Latin, little bag or sac, Greek, inflammation. Anytime we hear itis, inflammation. All right, folliculitis is a bacterial infection of the hair follicles. It can occur anywhere in hair-bearing skin, but most commonly found in the groin, axilla, or bearded areas of men. When it is in the bearded area, it is called barber's itch or folliculitis barbae. All right. A scary one for anyone with wet rooms, shower rooms, spa tubs, or hot tubs. There is something called hot tub folliculitis that can occur after using hot tubs that were not cleaned properly. All right. This can affect your clients all over the legs, hips, and buttocks. And then these can get worse, spread, and become boils or furuncles, which we will talk about in just a moment. So, if you are a massage office like mine that offers a hot tub to your clientele, please be aware you have to really make triple sure that you are cleaning that for a variety of reasons. But you certainly don't want to give them a bad case of hot tub folliculitis, which will look like they've been attacked by bed bugs. And it's just going to go incredibly down from there for everyone. Massage and folliculitis, what you need to know. Same thing as acne, avoid it. It's a bacterial infection of the hair follicles. You don't want to make it worse by putting heat on it or adding bacteria or trapping bacteria in there with the massage oils and lotions. Now, talking about these images for a brief moment, you can see the bright redness of the rash in this lighter skinned gentleman's thin beard. It's a little sparse. That red is really easy to see on the lighter skin. If you were to feel it with your hands, you would feel little raised areas around the hair follicles. Instead of being smooth skin with hair just growing out of it like grass, it's going to be like little hills with the hair coming out of it when you touch each follicle. If you start to feel that, and cannot see it for whatever reason, please ask your client what is going on in that area. If it is on someone with a darker complexion, instead of turning red around it, it may turn darker brown or towards like a black color. As you can see in this one, you see some of the red as they start to come to a head and the inner skin is exposed. But on the outer layer, this could potentially look like light scarring. It could look like any type of rash or darkening of the skin. So please be aware these conditions are the same, but they can look different on people with different skin textures as well as different skin tones. Someone who has a very reddish tone to their face already, like this gentleman has on his chin right here, it's harder to see these red infected hair follicles against the red general area of his skin than it is over here, where it's really pale and then suddenly he has a red one. So just please be aware that you may not always have the best visual clue, or it may look completely different on three different clients. So please make sure that you are asking really in-depth pathological questions for your intake, for your safety and for theirs. Now, impetigo. Hopefully you don't see it because it is a bacterial infection that's mostly seen in children. The lesions usually occur around the mouth, nose, and skin folds like the axillae, and that's where you usually see it in adults is in those skin folds. If you're working on someone that has a lot of skin folds, maybe around the waist or in those armpits in the axillae, you might be coming across this. This is a highly contagious bacterial infection, and it spreads by contact with the infected person or by handling contaminated objects such as eating utensils, toothbrushes, towels, doorknobs. bed linens, anything that they've touched in your office or come into contact with. All right. Please be aware of that. These lesions rupture, they ooze fluid, and then they dry to form a yellowish brown, like honey-colored crust. Okay, so that's what it looks like. There may be enlarged lymph nodes around the area, especially if they have a lot of lesions. If for some reason you're doing the back and your hand is going like in towards the armpit, and you didn't do a visual inspection first, or you haven't seen it, you're going to feel that it suddenly becomes wetter. Make sure that when you go into these areas, that while you don't want your hands so dry that it's dragging skin, you don't want so much lubricant on your hands that you can't feel when the skin suddenly goes from dry to moist on your client if it's an area that you cannot see very well. You're going to feel this yellowed crust is usually harder around the edges, but in these raised middle sections where it is still covering a moist area, it's going to feel like several thin layers of pastry sheets as your hand goes over it. Your book says impetigo is a local contraindication, that skin lesions must be completely covered during the massage. You need to use gloves or other barriers, such as the sheet. What? No, no. In this case, Mrs. Ellis is arguing with the book. A wet lesion will soak through the sheet, and if it's contagious, you've just contaminated yourself, plus you've contaminated your whole sheet. And guess what? Not only are massage linens treated as contaminated, this can spread. They can cross contaminate with other sheets. Now, I don't know if you remember from week 1 when we were talking about proper disinfection and laundry and washing your towels. Um, but if you let your towels sit for a little while, even if you've done a cold wash, which is why we recommend doing very hot or sanitized wash with bleach. But if you have cold wash or just moist towels waiting, the E. coli from fecal matter can blossom and grow so much on there that after a short while, it's literally cleaner and less E. coli to shove your face straight into the toilet than it is to use one of these dirty towels. Well, impetigo can also spread on towels and can cross contaminate things. So please be aware of that. Please, please, please sanitize your linens. And honestly, this is a total contraindication for me until they are completely cleaned up. I don't treat people with impetigo in my office. Boils and carbuncles. All right. Boils are infected hair follicles that manifest as painful pus-filled mass or abscesses. Boils are also called furuncles. All right. They can occur anywhere on the body. When they start grouping together and you get like a mass of them, it is called a carbuncle. All right. These can also be accompanied by cellulitis, which we're going to talk about in a minute. People who have diabetes or suppressed immunity are at increased risk for boils and carbuncles. Some boils and carbuncles are methicillin-resistant Staphylococcus aureus. They are MRSA infections, which are really, really, really hard to treat. Okay. And a lot of times your client won't know that they have MRSA yet because boils stick around for about 2 weeks. They have to drain before they could heal. They may not know that they have MRSA. These can spread through contact with the infected skin, contact with infected items like towels, clothes, floor mats, doorknobs, hard surfaces of your massage table. You have to wash your hands, sanitize your hands, especially in high risk areas. If you work in a hospital or healthcare setting as a massage therapist, if you work in a gym or work out in a gym, oh, Sula, sanitize everything. Or educational buildings, everybody that's hearing this lecture that goes to school on ground better get up and wash their hands before they leave for the day and go into their car. MRSA is highly, highly dangerous. Um, and it's more common than you think. For those of you that obsessively trim your nose hairs, stop right now. When I was taking microbiology in college, or many years ago, I had a classmate who had done a nose swab. We were doing swabs of ourselves and other objects, putting it on an agar dish to let it grow to see what kind of fun bacteria that we had on our bodies. And she had MRSA big time in her nose. Now, she nearly had a panic attack, but as the teacher was explaining, hey, look, this is exactly what your nose is supposed to do. It keeps that MRSA from going on other places. It captures things before it goes into your body. But if your client's a nose picker, they're going to dig out that MRSA and touch your doorknob, or dig out that MRSA and put it underneath your massage table, like someone put used bubble gum one year in the spa. It was so gross. There was used bubble gum shoved up underneath the massage table. So clients are gross because people are people. So please be aware if they have a bunch of carbuncles, all right, they have groups of boils, please, please, please make sure that it's not potentially MRSA. All right. Signs and symptoms, you're going to have this painful, tender, red, or like swollen nodule in the early stage. Eventually, it will erupt either externally, which is what you want, or internally, which can cause a bad infection. But before it can heal, it has to rupture and drain. It can't heal until all of that pus and bacteria-ridden liquid is drained out. Boils and carbuncles and MRSA, according to your book, are local contraindications. Now, while I agree about boils and carbuncles, MRSA to me is an absolute fever red stoplight contraindication. It's a total contraindication. Do not massage people with MRSA. Disinfect your office if they've even walked into your lobby. Please use gloves, other barriers. Treat your massage linens like they're contaminated. You have no idea what's actually causing these infections. Sure, this looks like really bad acne maybe on this gentleman's face up here on the left. Guess what? They put their face down in the face cradle. That is now smeared on everything, and I hope it hasn't soaked through your linen to your table. All right, this gentleman down here with this oozing starting to scab over carbuncle, that needs to be cleaned up and drained fully so that it can start to heal. Cellulitis, little cell or inflammation. It is a bacterial infection of the skin and underlying tissues causing inflammation, but it is not contagious. Okay. You can see in these images here that like one leg will be bigger than the other, or like the hand is swelling. There is edema. You can even see it in this eyelid. What you will feel under your skin, like this gentleman here, you can see it on his shin, but it's not very swollen. But you will feel this raised, suddenly smoother, bouncier section of skin. It'll feel bouncy because of the fluid underneath it pushing back, almost like a little waterbed mattress under there sometimes. And you'll feel the peaks of the swollen skin and then the little dips or valleys of the hair follicles as it pulls that skin down back into that follicle. And you can definitely, I would always, if a person has two limbs, always put your hands on both limbs and to see if one feels bigger than the other so you can assess swelling in one side of the body versus the other. You can see here that it also will potentially be red in people that are lighter skinned. It is an infection. And this gentleman with darker skin tone, again, we're turning this darker color here. It does not necessarily turn a bright red. So please be aware of that. Sometimes here we have swelling and some yellowing of the skin. It's not even true redness. So please be aware be aware that it can look like different things. If it's left untreated, all right, so tell your clients if you see this, because if it's left untreated, cellulitis can spread into the bloodstream, become systemic like septicemia or sepsis or blood poisoning, and can be fatal. Erysipelas, all right, St. Anthony's fire is a superficial form of cellulitis, and it's more common in children and older adults. I think if you watch the chapter lecture I think I have images of my mom's cellulitis. She got cellulitis like 2 days before I did the chapter lecture. Uh, and I made her go to the ER and I took a bunch of photos of her swelling leg. So enjoy a live action of the Ellis family cellulitis saga, I think if it's in that lecture. At any rate, it is characterized by local swelling, redness, warmth, right? It's going to feel warm and their skin might hurt. It might be really tender skin. All right, depending on the severity of the condition, treatment might require antibiotics and possible hospitalization. Cellulitis is a local contraindication. It is not transmitted by contact and does not spread person to person. So, if you do notice signs and symptoms of cellulitis, especially those diagnosed in cancer, refer them to their healthcare practitioner right away to get checked out. Again, it can become systemic and be life threatening. So, make sure you talk to your clients if you notice any differences in their limbs, especially in the lower limbs. Most cases of cellulitis is going to be on the lower body, especially on the lower portion of the limbs. All right. All right. Paronychia. Paronychia, not to be confused with petechia, which we will get to at a later date. Paronychia, near the nail. It's an infection of the skin surrounding a fingernail or toenail. Paronychia. It can be acute or chronic. Acute cases are usually caused by trauma or injury, like nail biting, picking at a hangnail, or aggressively trimming or manicuring your nails. All right. So, like, this is an image of acute paronychia right here. All right. Chronic cases occur mainly in people who constantly have wet hands, like housekeepers, hairdressers, and nurses. You can also see this in people with eczema, psoriasis as a side effect of their medication. All right. So please be aware of that. Or people with diabetes or diseases which suppress immune responses are more likely to develop paronychia. All right. So paronychia is a local contraindication. Skin lesions need to be covered. Um, treat your linens like they are contaminated. If you have paronychia as a massage therapist, wear gloves during the massage. There's some treatment here if you want to stop and pause and read this PDF. This is a local contraindication. It is an infection, but it's not a systemic infection, and it's not likely to spread very much. So just please be aware that maybe ask them to wear a glove if it's really bad, or a Band-Aid or two to completely cover the exposed finger or toe, and then you can work as normal, and then just treat everything as contaminated afterward as a safety measure. All right, those are the main bacterial infections. Now we're going to talk about fungal skin infections. These are superficial fungal infections, and they usually manifest as a rash caused by dermatophytes. All right, they're called tinea. These are the type of fungi that will get in and infect you and give you fungal infections. All right. There is a table in your book that gives you the name, like Tinea barbae, which is a fungal infection of bearded skin, or Tinea capitis. All right. Capitis makes you think at the top of your head, right? Well, perfect, because it's a fungal infection of your scalp. Tinea mannis, mannis meaning your hands. All right. Tinea pedis, that's athlete's foot. Pedis, like pedicure, that is your foot. Now, the first one we're going to mention is ringworm, which is a fungal infection of the skin. This young gentleman here has tinea capitis. It's a ringworm infection of the head. These are two images of what ringworm looks like on different skin tones. It becomes redder in light skin tones and usually lighter because it's raised and fluid filled in darker skin tones. This is not a case where it turns darker like it did in the bacterial infections that we saw. In this case, it usually turns lighter. When you are palpating it, if they have it and you don't see it, and you just accidentally run your hands over it, it's going to feel like raised rings underneath your fingertips, like a little bulging concentric rings inside of each other. Sometimes the size of the pad of your thumb, sometimes the size of a $50 with concentric rings going down. There could be just a single one, or there could be many, many together grouped in. This usually affects non-hairy areas of the face, trunk, and limbs. This is called ringworm because it's shaped in a round ring, not because it has a worm in it whatsoever. It is from a fungi species called dermatophytes, which I mentioned on the previous slide. So this is not an actual worm or parasite. This is a fungus. The affected skin itches, it burns, it can ooze a clear fluid, it can appear darker or lighter in color. It is a local contraindication or contact precaution. It can be transmitted direct skin to skin contact or contact with domestic animals because they'll get it and they'll spread it. A lot of people get it from their cats. I believe that there is a discussion question about cats being a fomite and passing things on that has to do with a fungal infection. But anyway, contact precautions are methods to reduce or prevent disease transmission. All right. You need a barrier and you need to disinfect all contaminated surfaces. Anything that this client has touched after touching their ringworm infection is going to be contaminated. To be completely honest with you, while this is a local contraindication, this is another one that Mrs. Ellis is just like, unless it's a small singular spot that they have under a bandage, it is a total contraindication for my office. Um, I just like all infections to be cleaned up before they come in. Athlete's foot. This is super contagious. It is a fungal infection of the foot or feet, mostly the soles and between the toes. Um, it is really prevalent around with teenagers and adult men, no comment, as well as people with weakened or impaired immune responses, such as diabetes. All right, you can get this with infected skin or contaminated objects, such as them walking across your massage floor, using a hot towel on the feet. That's always one of my suggestions is, hey, let's use a hot, moist towel on the feet so that when your client comes in, you can put some drops of essential oil on there if they don't have any contraindications with a particular oil. And not only can you provide this antiseptic or antibacterial oil on their feet, you are washing away a lot of the sweat or the grime with the hot towel, and the client feels like it's a nice, warm, decadent spa maneuver when really you're just trying to warm up the tissue and get some of the funk off before you touch someone's foot. Now, if they have this, you are really at a potential of spreading it on your towels. You're at the potential of spreading it on your linens, at the potential of spreading it from your floor. So please, please be careful with that. This is called tinea pedis. All right, pedis like pedicure, tinea pedis. There is an MBLEX question, I believe, that I've seen a couple of times. It is if your patient has pediculitis, what do they have? And they ask if it's athlete's foot. No, athlete's foot is tinea pedis. Pediculosis, sorry, pediculosis is lice, which we will talk about later on. All right, it is characterized by itching, stinging, burning sensations. It will be discolored with a raised red border. It'll have an unpleasant, musty odor. All right, it'll feel kind of moist and spongy if you touch it. And then the outside edges will be really flaky and dry around it. Okay. When you have these flaky, crusted edges to skin infections or fungal infections, all right, it's not flaky, flaky, tasty, tasty like a flaky pastry. It is skin sheets coming off that can be crunchy and crusty around the edges as they dry off. and the center will be moist to the touch, like a wet sponge or a jelly-filled donut. All right, so please be aware of what you're touching, and please be careful out there. It is a local contraindication. You're going to want to disinfect everything and sanitize that set of sheets separately, honestly, so you don't cross-contaminate things for sure. Please just be very aware if they have it. I do work on clients that have athlete's foot. I usually make them put on a clean pair of socks, and those socks remain on while I'm massaging them, and then we treat everything like it's contaminated afterwards. Nail fungal infections. These usually involve more than one nail because it will spread, and it can be transmitted by contact with infected skin or contaminated objects, just like athlete's foot. It's affecting a different area of the foot, but it's spread just about the same way. Um, it's called tinea unguium or onychomycosis. All right. It is there's a variety of species that do this, but it's very difficult to treat because antifungal agents don't penetrate into the nail bed. You basically have to almost remove the entire nail and treat and retreat and retreat and retreat. Most cases require oral treatment to kill it from the inside. Sometimes you'll get this flaky skin around it. Sometimes the skin won't be affected at all. It's just the nail itself. Sometimes you'll have a moist, musky, rotting odor that comes out from underneath these as part of the nail bed rots underneath it. And the nail becomes extremely spongy and can crumble apart itself. I'm sorry, I'm making a face as I'm talking about this. I've had close encounters of the nail fungus kind, more than I would like to have ever had in my lifetime, especially since I don't do pedicures. All right. Nail fungal infections are local contraindications. They are contact precautions. I don't massage these even with gloves because you can transmit the fungal infection from two infected toes of their toes to their other toes that don't have it on them if you are spreading it by doing a massage with the gloves. So I treat this like athlete's foot. I ask them to put on a clean sock, keep them on, and just massage them without necessarily doing the feet. You can definitely get closer than that if you like. If you would like to massage them with a glove, you can. Please be aware you don't want to cross contaminate between unhealthy and healthy nails, though. All right. You can use a barrier like the sheet if you don't have broken skin, but honestly, just don't. You're contaminating your sheet more. Jock itch. All right. Jock itch is a fungal infection in the groin, sometimes spreading to nearby areas such as the medial thighs and buttocks. All right. So why are we talking about jock itch? One, it's a pathology we have to learn. You're like, but Mrs. Ellis, we don't massage that area. You will massage the medial thighs and you will be doing glute massages, and this can spread. This can absolutely spread. It's gonna feel dry around the edges, but raised, um, like a large, like dry ring. And then that inner skin that's all like in here is going to feel moist and bumpy. All right. It is mildly contagious, but it absolutely can be spread by contact with infected skin. If someone's embarrassed and hasn't told you they had jock itch, and you are doing some nice pulling maneuvers, right, on the medial thigh, rolling that skin laterally to move all of that meat of the hamstrings that people really like. You could just be grabbing edges of that jock itch rash and not even know it. And it's so dry around the edges, they're not going to complain about it because you're moisturizing the edges of their jock itch. So please, this is called tinea cruris, tinea cruris. Please be careful of this one. Um, Treatment is antifungals. They need to wear absorbent, clean, and loose clothing. anything that comes in contact, your linens and stuff, it is all considered contaminated. You need to ask the client, massage and jacket. You need to ask the client how widespread the infection is because lesions may be found across the buttocks and medial thighs. Affected areas are local contraindications or contact precautions. All right, use gloves or other barriers such as the sheet. Again, I'm going to argue a sheet is not, especially not these thin, low thread count sheets, they are not barriers to moist rashes or pustules or things that are exploding. All right, absolutely not. Please use more than the sheet. Use gloves. Use something else as a barrier that is impermeable, that things will not pass through. A sheet is semi-permeable. That fabric will catch some, but those holes in between the fabric will not catch the rest. Treat your linens as they are contaminated. And that is it. We are stopping here to begin lecture 3.2 tomorrow. Have an excellent day and go wash your hands.